Good afternoon and welcome to the AgrAbility webinar series. Our topic today is dealing with 211 and the information and referral networks. And our presenter is Shai Lewis, and I'll give a little bit more information about her in just a minute. Before we get started with the actual presentation, I have just a few brief instructions. So I'll pull that up. You will need headphones or speakers in order to hear the presentation, as we're not using a phone connection today. If you would like to check your connection speed, you may do so in the meeting menu at the upper left of your screen. If you have questions about the presentation, please go ahead and type those into the chat window on the left side of your screen. Anytime during the presentation, you may do that. Or at the end, during our question and answer period, if you have a webcam or a microphone, you may use the raise hand icon at the top of your screen, and we will activate your microphone so that you may ask your question verbally. We will also have 4 quick poll questions at the conclusion of the webinar, so please stick around for those. The session is being recorded and will be archived at the URL listed on your screen. And in fact, the PowerPoint is already available at that URL. So if you'd like to click that and get that PowerPoint or just bookmark that page for future reference, please feel free to do that. If you have any technical issues during the presentation, please type that into the chat window. And if for some reason you're not able to use the chat window, you may email us at agrability@agrability.org. Some issues that we have had, if we are disconnected with our presenters, please just hang on and we will reconnect with them as soon as possible. If you get disconnected as a participant, please just log in again. For those that are not familiar with AgrAbility, it is a program sponsored by the U.S. Department of Agriculture. It focuses on assisting farmers, ranchers, and other agricultural workers with disabilities. There are currently 23 state and regional AgrAbility projects that cover 25 states around the country. And there is one national AgrAbility project, which is led by Purdue University's Breaking New Ground Resource Center. One of our partners on the national grant is Goodwill of the Finger Lakes, where our presenter, Shai Lewis, is employed. In addition, we're partnering with the Arthritis Foundation Heartland Region, University of Illinois at Urbana-Champaign, and Colorado State University. Please feel free to visit agrability.org if you'd like more information about the program. Now I'm going to turn things over to our presenter, Shai Lewis. Shai has been involved with contact centers since 1989, and she joined the 211 Lifeline program at ABVI, Goodwill of the Finger Lakes, in 2003. Shai has a master's degree in counseling from Counseling and Human Development from St. Lawrence University, and in addition to her formal degrees, she's certified through the Alliance of Information and Referral Systems, which is known as AIRS, as an Information and Referral Specialist and as a Resource Specialist. So I will turn things over to Shai for the body of the presentation, and then I will return.
Hi everyone, my name is Shai Lewis, and as Paul mentioned, I am the manager of the 211 Lifeline program at Goodwill of the Finger Lakes. I'm also a member of the AIRS training committee and present each year at the National Alliance of Information and Referral Specialists Conference on the ABCs of INR, sort of the basics of INR. And we're very privileged today to be here to tell all of you a little bit about information and referral and how information and referral could be helpful to you do in your communities and how you can connect to the information and referral that serves you. We start with a slide that sort of shows the Human Services Network and how it looks to a lot of people who are out there seeking assistance. The top bubbles are types of problems that people may be looking for help with rent, help with alcohol or substance abuse, perhaps mental health concerns or thoughts of suicide, assistance finding childcare, assistance knowing where to volunteer or to give help in their community. If you have one of those needs in your community, it can often be difficult to find your way and to figure out what human services exist that could help you to pay your rent, or could give you information on detoxes or rehabilitation centers or mental health counseling or emergency services for situations like suicide. Even navigating where to find appropriate childcare in your community or how to offer your help can be very difficult. You may get messages like our reference below. Oh, we can't help you. Oh, we don't need volunteers right now. I'm not sure. Can you hold on? I'm going to transfer you to somewhere else. Oh, we only do that. Those are really frustrating messages for people in the community to receive as they try to navigate the system and get assistance for their needs. With an information and referral program, we're going to try to streamline the system, and it can be an incredibly efficient system to direct people to the correct services, hopefully the first time that they make a call. So information and referral programs can say, yes, I can connect you with someone who can help. And we know right away where the drug rehabilitation centers are. We know about the volunteer programs and the rental assistance programs. We can get you connected with the correct place that lists all of the child care resources in your community. Or if there's a mental health crisis, we can tell you about counseling options or the mobile crisis team as mentioned here. The system becomes much more streamlined and efficient, and people in the community are much less frustrated by trying to connect with services because we've been able to direct them based on a needs assessment and information about what they're looking for. So what is information and referral? Just to back that up a little bit, organizations that connect people with services. That's the very simple definition of information and referral. But we're different than a 411 service or a place where you can just go for a telephone directory. People don't know where to turn. They very rarely will know the exact name of the agency or program that they're looking for. More often, people looking for help will have a need but not know where to start. So if they're searching the internet or making lots of phone calls, they might not be making the right connections, and they might be spending a lot of time connecting with agencies that can't actually serve them. So we're trying to help information and referral, or INR, is trying to help people negotiate that maze, really connect to the services that are available in their community and that the person is eligible for. We've been part of the health and human service industry for over 50 years. Information and referrals exist in most communities. There's some form of information and referral that's out there. We'll tell you a little bit more about how to connect in your community later. But just continuing with that definition of information and referral, what exactly does that mean? If it's not 411 or a telephone directory, what is it? We maintain comprehensive databases of resources. Those resources usually include all of the federal, state, local government agencies, federal and not-for-profit agencies, private agencies. We list libraries, which often have a lot of great community information available. We also will look at the neighborhood and civic organizations that might exist in a community. Basically, we keep a database of hundreds and hundreds of different pieces of information, depending on the size and the scope of the information and referral. Just to give you an example, the information and referral program that I run, we list about 1,500 different agencies and about 6,400 different individual programs which could serve people in need in our primary 6-county region. That's a lot of services that are out there that people might be trying to navigate and find on their own. Our INR specialist at any information referral program is going to work with callers to find the help that they need. We're going to assess their needs. We're not just going to say, you don't know the telephone number, you don't know the agency, we can't help you. We're going to say, tell us a little bit more about what you need. Tell us how this came to be. Tell us where we can help you. Tell us what your primary needs are. Tell us what your secondary needs are. Tell us what the boundaries that you have are. We'll find out a little bit of information about the person in need in order to make sure that we're directing them to the proper referrals. We'll look at eligibility requirements. Before we refer someone on, we'll make sure that it's a service that, based on our assessment and the information that the individual in need is able to provide for us, is a good fit. We're trying really hard in the information and referral world not to refer people to places that they're not eligible to receive services. That's frustrating for everyone. Every information and referral specialist has some basic training in how to intervene in a crisis situation. However, most information and referral programs are not also crisis lines. So there's a distinction in many communities between a crisis line and the information and referral line. There's a few communities like my own where there's a blended service and the crisis hotline and the information and referral hotline happen to be at the same place and answered by the same staff, but that's more rare. But every information and referral specialist needs to have some basic training in how to de-escalate the situation enough to get them connected to a person who is trained in crisis intervention. Information and referral specialists are also able to advocate on behalf of the caller as they might need, perhaps making a phone call to ask some additional information of the agency that we're referring to find out more about their eligibility criteria if it's unclear or the person has had some trouble, or perhaps just making sure to warm transfer a domestic violence victim over to the domestic violence shelter so they don't have to be brave enough to make a second call. Those are some of the types of situations that we might provide advocacy on. Each individual information and referral program has its own advocacy policy on how and when they would advocate on behalf of the caller, but certainly there are many situations where we might do some extra work to make sure a person gets the services that they need. When we're talking about information and referral, for most of the presentation, I'm going to be talking about a comprehensive information and referral program, one that covers all different types of health and human service needs. When you're operating a comprehensive information and referral, we're really looking at the totality of the services that are available throughout the community, covering a whole broad range of programs and services. Our services are categorized by something called the taxonomy of human services, which is kind of like the Dewey Decimal System for human services information. So that's maintained by AIRS and 211 Los Angeles, and they maintain that taxonomy of services, and all of the information and referrals in the country contribute to that system of categorization so that we can share aggregate data. As we are grouping information into our databases so that it can be retrieved for help, we are looking at these top level categories: basic needs, consumer services, criminal justice and legal services, education services, environmental quality issues, health, income security, individual and family life, which is a huge, actually, sort of bucket category for a lot of things about helping a family live to its potential and individuals live to their potential, mental health services, general organizational and community services. Those are all the top level categories in that taxonomy of human services by which we group information for later retrieval. There's also something called specialized information and referral. We provide in-depth information about a very specific population group. There's information and referrals specifically for older adults, people with disabilities, children, victims of violence, people with mental health issues. Some comprehensive information and referral programs might also operate a specialized INR service. For example, we are a comprehensive information and referral program here in the Finger Lakes region, and we also answer a statewide specialized information and referral program for folks seeking cancer screening services. So that's a specialized type of INR that we provide with some special information listings. And there are other specialized INRs around the country. As we close the workshop, I'm going to let you know how to connect with some of those specialized INR services as well. So operating standards. Most information and referral programs are eligible for program accreditation available through AIRS, which is the Alliance of Information and Referral Systems. That program accreditation accredits everything about your agency from top to bottom, from your service delivery to your resource database to your community outreach to your physical plant, to your all of the standards for operating a good, healthy program. There's also national level certification testing for individual staff members. So as Paul mentioned, I have received the certification as an information and referral specialist, a frontline specialist who talks to folks over the phone or on the internet. And there's also a certification for the people who manage the database. You could become a certified resource specialist. Having those standards in place helps the information and referral program, if they choose to do those standards, to be able to say to their communities that they pass muster, that they are doing a good job, that they're following the guidelines prescribed by our industry. Most of the 211s in the country are going to be accredited through AIRS and have as many of their staff as possible certified as either information and referral specialists or resource specialists. Which then brings me to 211. So what's 211? Many of you may have heard of it. We want to make sure that information in referral, is easily accessible to everyone in the country. It's not quite there yet, but we're getting there. It's a very easy to remember telephone number. It makes access to help easy anywhere in the country that 211 is available. You don't have to look in the phone book or look on the internet to find your information and referral program. Hopefully, as we continue to grow 211, people will just know that it's the place to call for health and human services information. It was designated by the FCC some years ago, but rolling it out has been the responsibility of each individual state, and then different coalitions within each state have to figure out how to make 211 happen in their communities. We'll look at a map in just a moment that shows the layout of 211s across the country and where we have access thus far. We really want people to have that easy, simple access, not knowing those 800 numbers, and remembering that no matter where you are when you dial it, it should connect you to your local or regional call center. However, unlike 911, 211 isn't an emergency service access point. It's not a place where we would call for emergencies. It's also different from 411. We don't list, say, the pizza joint, which some folks think we do. So that's a little bit different. That's another kind of N11 service. And there's a whole bunch of N11 numbers that range from 211, which is the lowest, all the way up through 911 for different types of easy to remember service. Here's our population map that shows a little bit about coverage in the United States. As you can see, as of February of this year, we had achieved 90.6% overall coverage of the population. So that's really good. We're almost there. We have a few pockets, some even in my home state, that we still have yet to cover with 211 service. But there's getting to be fewer and fewer areas where a person couldn't dial 211 and receive information about the health and human services information in their area. And you can keep up to date on this map. We'll give you the website at the end so you can continue to see and connect with local programs before the end of the workshop. We'll let you know where you can do that. So some general 211 standards. Not every 211 follows these exact standards, but you can be pretty sure that if you dial 211, you're going to find an organization that has a computerized database. As Paul mentioned, I started in the field in 1989, and when I started, we had Rolodexes and great big binders full of information, and we had to try to find them through table of contents. But today, it's pretty hard to do information and referral without a computerized database, where that information has specific database elements that are collected for every entry, so we're consistent across the board in the types of information that we gather. So we gather for every agency, for example, their name, their AKA names, how others in the community might know them, sort of those common names that aren't necessarily the organization's official name. We take some information about all their different phone numbers, fax numbers, TTYs, other methods of access. Information perhaps about their hours of operation, their street address. Are they accessible by bus, or are they accessible for people with wheelchairs? Do they have people on staff that speak Spanish or other languages? In addition to a list of all of the services that they provide and what you need for intake. How do you present yourself to that agency? We don't want to send someone to an agency for services and then find that they have to go back and get their social security card or their birth certificate or have a referral from a third agency. So we try to keep all of that information in our database entries for each agency. And then we classify every entry according to that taxonomy of human services that we talked about earlier. In general, every good 211 is going to have some call protocols, kind of document about their flow, how do calls flow through the system, and how are we trying to help folks. In general, 211s don't follow any kind of script. It's one of the cool things about our service that each individual information and referral specialist is really able to direct the call on their own without necessarily having to follow any kind of setup script, and they can't move past it until they click a certain button that you often see in more commercial call centers. Each individual specialist is empowered to begin that conversation with the person and follow it to its end. But generally, you're going to find that each specialist will want to be listening and just doing a little bit of listening and empathizing upfront about the situation, gathering some details, facts, asking some clarifying questions, and creating an assessment of the person's primary needs, the most urgent things that they might need to deal with. And then generating some ideas, often in conjunction with the person who has contacted us for service. So we're going to generate and do some brainstorming around what could help, what resources are there in the community, what tools does that person have at hand to bring to the problem, and then creating some kind of potential follow-up plan. What will happen if the resources or referrals that were offered don't work? Would you call us back? Can we give you a follow-up call? Follow-up is a big part of information and referral, checking back with a certain percentage of our callers, especially those who were high risk or had complex needs, to see if they were able to access the services that they needed. You're probably not going to find a 211 service these days that isn't really heavily invested in technology and other call center infrastructure. It's just the way and the nature of the beast at this point in terms of being able to have people access you quickly and efficiently. Most 211s will also have 24/7 capability. Very few times are you able to make a call during your workday. Sometimes it's hard to get away. And so we want to make sure that people have access to information and to services and to a listening ear, and someone who can help them navigate the human services system when the thought occurs to them, when the problem is coming up, when they have that time. So 24/7 capability is very important to being an accessible service. You're going to find that most 211s are also accredited by the Alliance of Information and Referral Systems, or potentially in the process of becoming accredited. It's a pretty complex and lengthy process, very detailed. Certainly if you've achieved accreditation, you'll know that you're doing a good job. It's a very detailed process. Most 211s are also going to be web accessible, and that can mean a couple of different things. Primarily, it probably means that they have a interactive database available on their website where people who are interested, professionals or the community, can go and do a self-search of the information and referral resource database. So there's usually a mirror of the database available on a 211's website where people can try to look for information themselves about services. If they're pretty confident what they're looking for or what their type of need is and they don't need that assessment process, they can go and do a self-search on the web. Might also be web accessible through live chat. Chat is another way that information and referral programs are beginning to make themselves available to people as another form of access. So people could instant message back and forth with an information and referral specialist to find the services or help that they need. Not every 211 has that yet, but we're moving more and more to it. We've been doing live chat at our site since about 2005, and what we've really found is we're tapping into a group of people that hadn't previously made phone calls. They weren't the same users. They weren't the same people coming to us through the phone as we're coming to us through chat. And also the live chat service makes it so that folks who are hearing impaired can seamlessly access the service without using a relay service or a TTY. And it makes it so that young people who maybe aren't really phone friendly can also access the service very easily. You're going to find call center technology, like an automated call distribution system, to help keep the calls managed efficiently. If there are more calls coming in at a certain point in the day than there are INR specialists available to answer them, it could queue the call and then deliver it to the next available agent. You're going to find that every 211 has a TTY as well as perhaps that live chat option, and we'll also have multi-language capability in the primary language, second language that's spoken in their region. So if English is the primary language, most 211s will also have staff on board who are Spanish speakers and may or may not also have a language translation service, which would allow for individuals who speak all different kinds of languages to be connected with a translator. So there'll be a translator working with the person in need and the information and referral specialist. We can get 140 different languages within 30 seconds here at our site, and most 211 centers are working with a similar service provider who can get a translator on board right away. Every 211 has to educate the public about what they do. That's one of the big pieces, is that we're sometimes the hidden gem in a community, and that's why we're here today. We want to make sure that as many of you guys as possible know about 211 services and the overall concept of information and referral, so that you can make use of it and partner and save each other time and energy and efficiency. 211s will also be tracking calls in terms of being able to provide reporting. So there'll be fields for the information and referral specialist to not only track that a call came in and what referrals were given, but also some basic demographic information about calls. For example, most information and referral programs are going to track what geographic region the person is from, probably asking for their zip code. You might be asked your age if you call an information and referral program. Your gender will probably be recorded, and some information about what type of caller you were. Were you a family calling? Were you an agency calling? Were you an individual in need calling? And there's any number of other different types of information that the INR may report that's aggregate. Individual calls would never be shared, and individual information would never be shared without express consent from the person in need. But we do track a lot of aggregate information that we can share, and I'll tell you about that a little bit later. And again, as we mentioned, every 211 has to have some kind of crisis call capacity or an MOU with their local crisis center, because human service needs can oftentimes turn into a crisis, or a crisis can have human service needs related. So we want to make sure that people who maybe are looking for food or shelter also are screened and appropriately referred for any potential issues with mental health or depression or suicide. We want to make sure that we are a seamless system so that folks can get passed carefully back and forth to the information and referral or crisis center. So what's a typical call to 211? There's probably no typical call. That's why I like this industry so much. Every day is different. Every call is different. Every person's need is different. But when we look back at reporting, we see that some of the most frequent needs across the country tend to do with financial assistance, needing help with rent or utilities, needing help with housing, perhaps not having enough food to eat, or needing some longer-term referrals to keep food in the house. Some people want to donate goods or services. They want to help. Other calls involve looking for mental health counseling, or perhaps a support group that they could join for a particular issue. A lot of calls revolve around unemployment or employment assistance. We have calls about legal issues and make lots of referrals to legal aid organizations, parenting classes. It really runs the gamut. Examples of different types of calls that might come in. These are examples from my 211, but they could be examples from really any 211 across the country, or information and referral across the country. One call that we took, and I'm not going to give any names or identifying information individually, but we took a call from a woman who was very emotionally distraught. She was having a lot of concerns because she didn't get her SSI check. There had been a mix-up at the bank. The caller disclosed that she had a disability. She had a back injury, and she can't walk easily. And while we were assisting the caller, we learned she also needs a new place to live. She had rodents in her apartment, and it was really just too expensive for her to live there. She was also, because of all these things, short on food because she didn't receive her check. So there were a number of needs there. And as we began to assess the needs and identify the priorities, we were able to connect this woman to a food bank resource that would offer home delivery for homebound individuals. Some of those services exist, and we were able to find her one so she didn't have to go out. We also were able to link the caller to the elder care organization in our town that provides specific advocacy and case management, could also help her with long-term food and the social SSI assistance. We were also able to offer her a referral to an agency that provides low-cost legal assistance to advocate on behalf of the SSI check. As it turned out, there were some legal issues involved with that. We spent a great deal of time with this woman, supporting her. She felt very overwhelmed. So not only did she need those phone numbers, she needed sort of that care to sort out the system and to help her understand how to navigate it. We were also able to help her break down her approach to all of the multiple issues that she was facing into some logical steps that made sense for her and that she felt like she could approach. Here's another example. A caller was looking to have her son-in-law move back to our Finger Lakes region here to be closer to family after he'd suffered a spinal cord injury and had been in a nursing home in another state. He needed to come home and try to rebuild his life around family. He had been separated from his family at a time when he needed them the most, and they wanted to be there to help. So our information and referral specialist here at 211 in the Finger Lakes was able to speak with the caller about relocation services, case management, assistance finding a doctor, rehabilitation services, how to help with health insurance, help applying for Section 8 housing. And after we were able to kind of go through those needs and give her the most appropriate referrals, such as different rehabilitation services, Section 8 housing, went through how to apply for medical insurance. We then offered a follow-up call to this individual family after providing information about all those services and how to access them and how to apply. We followed up to see if she was able to get the assistance that she needed. And during that follow-up call, the counselor who made the call was informed that the son-in-law did receive all the services that he needed and that he was indeed scheduled to be moving back to the area any day. He'd been set up with an advocate and he received help applying for Medicaid, and that she was really satisfied with 211 services and felt that the initial service was super helpful and was incredibly pleased that we actually did follow up as promised, and were able to make those connections for her. Maybe one more example. We had another call from someone who was distraught and concerned about her brother. Her brother is mentally ill, and she believed that he was off his medications. His behavior had grown increasingly erratic, and she was really fearing for his welfare. She didn't believe he was necessarily an immediate danger to himself or anyone else, so she didn't feel like 911 or emergency services were warranted. And so a friend had suggested that she contact 211 for help. So what we were able to do in that particular call was assess the person for the level of safety involved. You know, what was happening there, and getting a little bit more information about what was going on. Based on the description, we were able to suggest that perhaps an interim solution before we had to contact emergency services would be a mobile crisis team. A mobile crisis team has mental health specialists who can actually go out in the community to assist in crisis. So we described how our local mobile crisis team operates and what supports they provide. And so we made a referral for her. And at our particular 211 center, we're also the intake point for the mobile crisis team. So we were able to seamlessly transition that into a formal referral to the team and get that information out to them so that they could follow up. We also gave some coaching around identifying signs of suicide risk and when to take the next steps to call because his behavior had been so erratic. So those are just a few different ways that we can help educate people about the Human Services Network. And there's lots more stories that we could tell. This is what happens every day at Information and Referrals and 211s across the country, helping people navigate, coaching them around the system, and helping them to know where they can connect for services, and then following up in certain circumstances to make sure those services were received. So what can 211 do for the community? In addition to some of those individual calls that I described, we can be useful for the community as a planning tool. We can use the aggregate data that we collect and that I talked about earlier to share with stakeholders and planners in our community. We share information back with the United Way. We share information back with community planners. Again, always in aggregate, but to help them figure out where those needs are. For example, if there is a lot of requests in a certain zip code for a food pantry where a food pantry doesn't exist, we can share that with the local food bank that helps establish food pantries in the community, or back to the United Way to let them know that there's an unmet pocket of folks in a certain area of a county that are getting their needs met for housing. We can share all that different types of information back. Gets a real sense of the pulse of a community, and that can be shared back with stakeholders. 211 can also play a very pivotal role in times of disasters or public health emergencies to assist in getting information out. Many times in a disaster, all of the phone numbers for FEMA and Red Cross are completely flooded with calls. And a 211 in the community can help people get that information a little bit more quickly about where can you go for food, where do they have shelters, where are the distribution sites for emergency services. We have been helpful as a 211 community all the way through hurricanes in Florida, starting in the early 2000s when 211s were really first coming into prevalence in Florida, through Hurricane Katrina. We did a lot of work as a 211 system around Hurricane Katrina and learned a lot of lessons that have made us incredibly helpful to communities in California with wildfires, in downstate New York with flooding. We took a lot of calls as a 211 system in New York State around the time of Hurricane Sandy, helping people find out where they can go for services. Helping people know what information is real and what isn't, a little bit of rumor control. A lot of things start being passed around in times of disaster that aren't true, when people waste time standing in line or seeking out services that don't really exist. And 211 can be a quick and easy place for people to get that information without clogging up 911, without overloading Red Cross or FEMA telephone numbers, and we can provide that assistance to our communities. So why is 211 good for your clients, good for you? Well, it gives you free access to the health and human service information, usually 24/7 via telephone or self-search on the internet or through that live chat service if it's available. As agencies help us to keep their data accurate, then we make sure that we're giving you the right referrals. We're giving you the people that you are able to serve and connecting you to those folks, and vice versa. You can refer folks back to us for things that are outside the scope of your services as you start to encounter them with individuals you're working with. If we're giving accurate referrals to your agencies, then that's going to mean less time wasted for your staff in redirecting people and saying, no, I'm sorry, we don't do that. You're going to need to call 211, or you're going to need to call this other agency down the street. It gives a place for your services to be publicized without any further effort. If you list with a 211 and you make sure that your information is in there, it's going to be retrieved by an information and referral specialist through that taxonomy of human services anytime a caller presents with an issue that is relevant to what you do. And 211 can save agencies time from maintaining their own information resources. Time and time again, we see agencies developing their own resource lists. Even within agencies, several different representatives from each creating their own specialized resource lists with their favorite agencies and favorite phone numbers, which is great, but as soon as you write that down, it goes out of date. An information and referral specialist is going to have access to updated information. One of the hallmarks of a good INR database is that every agency in that database has been touched at least once during a calendar year by someone who is affiliated with that program to verify that that information is correct. And for some agencies, it's many times a year. The high volume agencies or the agencies that go through big changes, we will track that information and make sure that it is up to date. And so it can just save an agency a ton of time from creating their own resource list. You can simply call 211 for that information. You could go to the agency's website and print it. You can hand it to a client. You can come back time and again to make sure that you're always giving out the most current information and that you're not missing new resources that may have become available since the last time you made your own homemade lists. Here's just a quote that shows one human service professional talking about how useful 211 could be in their community. As a social worker in an emergency room, I need fast and accurate resource information for my patients before they are discharged. I access the 211 website to find all the information I need, I print it out, and give it to my patients to take home with them. That's something that not enough human service professionals take advantage of, is feeling like they could also call the 211 or information and referral in the community for someone that they're working with. We welcome that as a system. If you're working with a family or an individual in need, please do give the 211 or the INR program in your community a call and see what other services are available. You've already probably done some assessment and some clarification of the problem, and that can be hugely helpful to us directing the person in need to the correct services. So for more information, where can you go? For more information overall on the 211 movement in the United States, to follow that map that we showed you earlier and see when it's updated for your community, you can go to the first website, 211us.org. The second website is an offshoot of the first, and it's where you can go for information about where is the 211 closest to your community. You can put in your zip code or your state, and you could search for the 211s that are available to you. You can also seek specialized information and referral. I've got a very complicated link that I won't read out for you, but if you pull up the PowerPoint and click on it, it will take you to a search page for Aging and Disability Resource Centers, which are specialized INR programs that deal with aging and disabilities, and will direct you to where there's an ADRC in your state, or if there's no ADRC in your region, it will give you information on the local area agency on aging and the Centers for Independent Living. So that's a multi-search through that particular resource. If you want to go straight to getting more information on the National Association of States United for Aging and Disabilities, NASWAD, you can contact them and read about them on their website. And if you're looking for crisis centers and want to make sure that that information is available to you as well, there are individual crisis centers with the direct numbers in most communities in the United States, but the easiest way to reach a certified crisis center is through the national umbrella of the National Suicide Prevention Lifeline. Their number is 800-273-TALK. Or they're also available on the website there for live chat services from 2 p.m. to 2 a.m. 7 days a week now. The hotline is open 24/7, of course. We're working on getting the chat program up 24/7 for crisis information as well. And I think that brings me to the end of my slides. We're going to open up for questions now. And that means I need to turn off my camera. Hold on one moment. Or do I need to turn off my camera?
Yeah, Shai, if you could make sure your microphone is muted, that would be great. Thanks very much for that excellent presentation. Some very helpful information, I'm sure, for everybody involved. We'll be taking questions, and so if you would like to ask a question, again, either type that in the chat window at the bottom left of your screen, or if you have a microphone, you may use the raise hand icon, and we will activate your microphone so that you can ask your question verbally. Before we start with the questions, I would like to give our four quick poll questions. The first one simply asks your professional affiliation. So if you are in any way involved with an AgrAbility project, we'd appreciate you using the first choice there. If not, please choose the best option below and let us know what type of agency that you're affiliated with. I'll give you just a couple more seconds on that one. Okay. Thank you for your input on that. The next question asks about the information that was presented during the session. Could you please let us know if you found that information to be valuable and whether it met your expectations or not? We'll broadcast those results in just a minute. Okay, thank you very much for your input on that. The next question asks about the technology that was used. Could you please indicate if you found the technology to be effective and useful today? If you had any specific problems, for example, if you were kicked out of the room for some reason technologically, could you please let us know specifics in the chat window? We would appreciate any information we can get on that. And we appreciate your input on that question. The final question asks if, based on today's session, whether or not you would attend another session in this series. Okay, thank you for your input. At this time, I'm going to turn things over to Shai again. And again, we do have time for questions. If you would like to ask one, please enter that into the chat window, or just simply raise your hand if you have a
There we go. Hi, I'm not sure if you can hear me. I'll get my webcam started in just a moment. My computer decided to choose now to become very slow in thinking about its choices. If you can hear me, so the question that I see is I work with farmers, and while they don't often like to ask for assistance, they often need it. So how would we respond to a call from someone who might be asking about financial tools? Or who might be needing help with business planning, but there might be issues far beyond that. We would do what we talked about in the call. We would do an assessment of needs. We would empathize with what the farmer is facing, perhaps do some work on coping skills and figuring out those immediate needs, as well as making those referrals. We could help with referrals for all those different types of things. The issues that affect farmers in terms of financial tools or business planning, life insurance issues, and those types of things are some of the same issues that we hear about every day in our communities. And so we are often able to make connections for people. Still waiting for my webcam to get set up, and I'm still not sure if folks can hear me. Okay. All right. Here we go. Okay, so we made some progress with getting me back connected. Thank you for your patience. So the next question I see is, how can someone advocate to get 211 if their region doesn't have it? If your region doesn't have 211, I would suggest that you contact your local United Way. 211 is a joint initiative of AIRS, who we've talked about a few times, the Alliance of Information and Referral Systems, and United Way Worldwide. United Way Worldwide and AIRS are trying to work together to make sure that 211 is available in every region. So first go to that website, 211.org, and check if there is one in your region. You might be surprised. But if indeed there is no 211 in your area, speak to your United Way representative and see if there is a plan to bring 211 to your community. You can also check and see with the closest 211 if they can refer you to an INR that may not be accessible through the 3-digit phone number, but does provide information and referral services for your community, and that might help. And is there another question? Can I explain any examples about how 211 has been used for transportation referral? Sure. We do a lot of referrals at most 211s around the issue of transportation. Transportation is a big issue, especially in a lot of rural communities that maybe only have one public bus system or no public bus system. Getting to services can be very difficult. So first off, the 211 would list any agencies that provide assistance with transportation, whether they be private or not-for-profit, whether maybe they have a small fee or other organizations that you could connect with that offer volunteer transportation and things like that. So we would work with the individual who presented their transportation need, try to get a little bit more information about it, and refer to an agency that exists that might meet that need if possible. Sometimes that's not possible, and so we will also just work with the individual to brainstorm around transportation issues as well and help them figure out how they can use whatever resources they have, whatever networks and support systems they have the most efficiently to get what they need. We'll also look at alternate services. For example, we talked earlier about the woman who was homebound and couldn't get out to a food pantry. So we were looking for a food pantry that would come to her. So we'll brainstorm around all of those issues to try to make sure that people get the services that they need. On average, how many calls do we receive per week? I haven't looked at the weekly stats at our particular 211, which isn't the same as every 211. Every 211 across the country is different, serves a different service region. Some are statewide, some are one county, some are 10 counties. It's very different. But at ours, which serves a primary service area of 6 counties, although some of our services are statewide or national, we receive about 9,000 calls a month, usually around 350 to 400 calls a day. How can we make sure our agencies are listed with 211? Call 211. That's the best thing that you can do. Connect, reach out. You could either make that phone call. If you make the phone call, you specifically want to ask for the resource department. Ask for that department to get the right people to share your information with. You may already be listed, and maybe you just want to make some corrections to that listing, so they'll let you know that. You can also go to your local 211 webpage by hitting that 211.org, finding your closest 211, checking out their webpage. You can look at the database that's available online, and most of the time you'll find an update button or a contact us button where you can say, that's great that we're listed, but you could add a little bit more information or clarity here, or our office hours have changed, or we moved last month. And there's usually a button where you can click and let folks know that you'd like to change something or add something or expand something, and the resource department will love you if you contact them and they don't have to go looking for you to make sure that that information is correct. Information and referral specialists love information, and we would be more than happy to hear from each of you to help educate us about your services. Last question, do 211 network providers share their databases with each other? Unfortunately, it depends. And especially if you are a national or a statewide provider, you probably are going to get a lot of requests. We are working to get the number out nationally across the board, and then we're continuing to work and refine how we work together best. And we've made a lot of strides. For example, in our state, we've made a lot of strides working together with the 6 or 7 individual 211 centers that are in New York State. We now have some agreements with each other about approaching jointly, or one person, one agency only doing the update mailing, so that you're not getting so many mailings, and we're sharing that out across. Some of the national folks have also figured out how to connect and go through that 211 US website or the AIRS website and ask, can we share our national information out to the community? So you can do that as well. If you're a national or statewide provider, you can get in touch with your local 211 and try to get that out ahead of time. And I'm getting information that that is the end of our time. So I wanted to say goodbye. Thank you so much for having me. If you have any additional questions about information and referral services, you can check with AIRS. You can check with 211 US or check with the Aging and Disability Resource Networks. This training has been archived. They're sharing with you the website that you can save and bookmark for later. And we hope you join us for the next webinar, and you'll probably be receiving an email letting you know about the next opportunity as it arrives.